Hello and welcome to episode number 25 of Healthy Knees for You. Today we are talking about why I chose to go with a custom knee replacement rather than an off-the-shelf replacement. If we haven't met yet, my name is Robin Robertson. I'm the founder of Healthy Knees Coach, and I'm here with Healthy Knees for You to help you make smart choices about your knees. First of all, let's talk about what the difference is between an off-the-shelf knee and a custom knee. So in a total knee replacement, there are three primary parts. The implant that sits on top of your tibia, your main lower leg bone, the implant that caps the end of your femur, and then usually an implant that goes on the underside of your kneecap. So those three components come in different sizes in an off-the-shelf knee. Lots of sizes, and your doctor is going to be able to make a pretty good guess as to what will fit you. He or she will have multiple sizes ready to go in the surgery so that they can then measure and select the right size of replacement for you. Now, the difference with a custom knee is that it was actually made for only your knee based on CT scans that were done probably 6 weeks before your surgery. So the custom knee is manufactured only to fit your particular bones. How does that work? I will link in the show notes below for the knee manufacturing tour that I went on with ConforMIS Knees. Now, they don't pay me to say any of this. They're the brand that I went with my custom knee, and I thought it was fascinating to see exactly how they were made. But I have my model here, so I'll show you. So your knee joint with the implants will fit together like this. This is your upper leg bone, your femur. This is your main lower leg bone, your tibia. And so when your knee bends, it's going to rock in the joint like this. And so the custom part of it is that this was shaped specifically to match my bone curvature. And I'll slip a picture in here where you'll see many different knees at the ConforMIS manufacturing plant that I was at. And we're going to just take a look at the knees. Now, one of these knees is my knee. And actually, can you hold that? Yeah, that'd be great. But they all look slightly different, don't they? So I have my left knee is, I should have arranged them the other way, but that's okay. So here's my knee, and you can see that it looks different than, let's see, here's another left knee, and our knees are quite a bit different, even just the shape here and this side. Now, this is the match for this person's knee. So that's, there we go, left knee, right knee. Anyway, but you can see even the difference between same person, different knees, and with the custom, that's the big kahuna right there. That's the big difference. So, and let's just take a look at how it looks on the condyle side of the knee. I'll slide my knee back in there. I've got this really interesting wrap here, right? So I'm just so impressed. And check out this very big bone, very large knee, little different than the other ones that you're looking at here. So I guess I'm just so impressed with the fact that the knee is made just for me and wouldn't fit anyone else. And in fact, they play a game here sometimes where they take off the components and then try to find the right match. And you can see that knee is not going to fit on my bone, and my knee is not going to fit on somebody else's bone. So I guess if you have to have your knee replaced, going with a custom knee just seems to make so much sense, because from the scan to the development to the manufacturing process to all their checks and balances in between. I just learned today that in an off-the-shelf knee, they often just check one of a batch. They don't check each knee. And in ConforMIS, every single knee is confirmed to meet the correct specifications. So that you can see that there's lots of different sizes and subtle shifts in shapes for how a knee looks. But you'll see I'm longer on one side than the other, and on mine I've got sort of this swoop to one side. So the cool thing is the CT scans for a custom knee, they use that to use a 3D printer to build this model of your bones. So this is the model of the end of my femur for my left knee. And then all of the cutting jigs that are used in the surgery are pre-calculated so that your doctor really doesn't have to use judgment calls of where to make the cuts, because the jigs are already set based on the CT scan and the model that they've made of your knee. Now on the lower leg bone, the tibia, it looks like this. This would be the front of your leg, and this is going to be the back of your leg. And so the top of the bone gets cut off, and this nice insert goes in the top, usually cemented in. Sometimes there's no cement procedures where bone just grows around the implant to hold it into place. And then this is a nice plastic for your meniscus. The metal can be made of a variety of metals. Mine was made of cobalt chrome. Okay, so the thing that's different about this, which is totally made to fit exactly my knee, and an off-the-shelf model, is that sometimes there can be overlap or underlap of how the implant fits specifically on your bones. So there's no overlap or underlap here because it was made for me, but in a custom knee, sometimes you might have that. An overlap may cause irritation of any surrounding soft tissues, your muscle, your tendons. And same with up here. So if the implant doesn't match specifically to the end of your femur bone, then you might have some soft tissue discomfort after your knee surgery. Most people, from what I understand from my doctor, have an off-the-shelf knee, and it works just fine. So why then did I choose to go with a custom knee? Well, it has to do with how the replacement is inserted during the surgery. The doctor has to be very specific about how the implant fits on your knee so that you'll end up with a straight joint and your body is weighted properly through that joint. Now, in my case, I have had 7 surgeries before my knee replacement on my left knee, and I had 3 surgeries before my knee replacement on my right knee. On my left leg, I had a procedure called an osteotomy. And let me grab my knee joint model here to show you. Okay, so this is a right knee, and I'll pretend it was my right knee. And I know it's a right knee because the fibula, the smaller of your lower leg bones, is on the outside or lateral side. I always think fibula lateral. That's how I remember. And so I was getting very knock-kneed because my lateral or outside meniscus, that's that nice thick cartilage that protects your bones from smacking on your bones, was gone. I had no meniscus left. And so my knee was starting to get knock-kneed like this. Now, without having a knee replacement surgery, the only way to correct for that was to cut the femur, put in some bone from my hip, and straighten out my knee joint, which resulted in a bend in the femur. So while it did buy me a lot more time, I had that done when I was 34 years old, Back then, that was too young for a knee replacement. And so I actually went another 22 years before I had my knee replaced because of that corrective surgery and because I was doing all the right things for my knee, which I'll talk about a little bit later. But the osteotomy bought me time, but it created a bend in my femur. And so with an off-the-shelf knee, one of the ways that your doctor, your surgeon, would align the joint properly is there's an aligning rod that goes up your femur. And because I had the bend, that aligning rod would not work for my knee, for my leg. And so my doctor really did not want to use an off-the-shelf knee for me. And when ConforMIS came around and he was trained in it, then he really recommended this custom knee because the cutting jigs were already done. He had to do less alignment work inside of the surgery so that he could do the surgery quicker, and the knee would be specifically made for me. I thought that was a pretty good deal. That was finally the reason that I said yes to moving forward, because there was a reasonable solution for my condition with a bent femur. Now, most of you probably don't have a bent femur, but the custom knee replacement was fully covered with my insurance and did not cost more than an off-the-shelf knee. So it is really worthwhile asking your surgeon if they do a custom knee replacement, or looking for doctors that are certified by ConforMIS, ConforMIS. I'll put a link in the show notes below, and you can find out if there's someone in your area that can consult you with doing a custom knee. I kind of like having a designer knee, and I had my other knee done with a ConforMIS knee as well, and it works fantastic. So I went with the custom knee because I had a specific issue with my legs, but I think it would be a great solution for anyone who wants a little more exacting fit of the implants in your knee. How did it all turn out? Well, it turned out fantastic. I have no complaints about my replaced knees. Both of them are replaced. My first one was done in 2017, my second one in 2019. Since then, I've ridden thousands of miles on my bicycle. I do long road bike rides, fully weighted bikes, and I'm able to do that with both my knees. I've brought hiking back into my life, which is a wonderful gift. I wasn't able to hike. I was only able to walk very short distances before my knee replacements. My knees no longer hurt at all. And I hope for you that you can have those kind of results if you are looking for a knee replacement. The key to getting those kind of results is not just the replacement itself. That is just one factor in reducing your knee pain. The key to having great results is to do the training beforehand so you get as strong as you can be before you have a knee replacement surgery. And then after your knee replacement surgery, continue with strength training and doing the kinds of movements that are good for your knees, not bad for your knees, after your physical therapy is done. You've got healing time after your surgery for at least 3 months, maybe a little more, but after that, continue on with the strength training. I highly recommend riding a bike because it's not weight bearing and you're getting that good movement in your knee to help produce healthy synovial fluid, which helps to lubricate everything inside your joint. And if you have any cartilage left in there, if you haven't had any replacement, then that's going to help nourish your cartilage as well. Now, the training is all of what we do in the Healthy Knees formula. I'll put a link in the show notes to that as well, because I want you to know how you can get started on doing this very simple at-home training that will make all the difference in the world for your outcome. And maybe you'll even feel so good that you'll cancel your knee replacement surgery altogether. A couple of our Healthy Knees clients have actually done that, or at least they've postponed that knee replacement until many years in the future because they got stronger, they reduced their pain, and they feel great. Now, one of the other questions you might want to ask is, what about robotic surgery? And I'll cover that in one of our upcoming conversations when I bring Dr. Thorpe back onto the show. All right, that's it for now. If you're finding that these videos are helpful, and I hope they are, I hope you'll subscribe to the Healthy Knees channel. Check out the show notes for the links that I talked about, and I hope I'll see you again soon. Every Thursday, I release a new video. I look forward to our time together and wishing you healthy and happy knees. Bye for now. Love that. So let me just get my knee back on where it needs to go and check out all these other knees here and how different they look. It's almost like a shell game. I'm gonna forget which one is mine, but really different appearance. And this is the femur. So when your knee is, when it's on your knee, it looks like this, and you're rocking this way. And let me just find mine. Yeah, there we go. So here's my tibia. I know, this is kind of geeky, but I get really excited about this stuff. And so here's how my knee is going to fit together. And it's nice and smooth. The action is pretty awesome. Now this isn't my actual knee. This is a replica of my knee, but it's the same material, same density. And it's just so nice to see it work before it's inside. Okay, we'll see you soon. More coming.